Good afternoon or good evening, everyone. This is Dr. Rolani. Congratulations on getting through your hair transplant procedure. I just had my transplant this morning, and I want to take this opportunity to make a video about what to do the night of your procedure. So when you get home, the first thing I'd like you to do is just have some food. It doesn't have to be a big meal, it can just be something small. You just want some food in your stomach, so as we start taking our medications, you don't get nauseated. It's rarely an issue, but it's just better to have food in your stomach. Number two, obviously you notice you have this dressing on your head. What is this dressing? This dressing essentially is an elastic kind of band-aid, and it's holding on an absorptive pad on the back of your head. That absorptive pad is just soaking up the fluid that is kind of now coming out of the back of your scalp. We did inject quite a bit of local anesthesia or numbing medication, and so you have small little holes back there. They tend to leak out. You notice that this bandage is actually pretty tight. That is important because we don't want this bandage accidentally migrating up into your new hairs. I've had new hairs placed into this area, so it's best to keep the bandage away from them. I know the bandage can get a little snug. If you feel like you need to get a little relief, just pull it away from your scalp for a second and get that relief and put it right back down. You are not going to touch that bandage for 2 days unless this bandage starts making its way up towards your grafts and puts them at risk. If that's the case, we want you to call us and we can advise you on what to do, whether it's taking it off or kind of repositioning it. But otherwise, that bandage stays on for 48 hours, and it's really there as just to kind of absorb any fluid. And after 24 hours or 48 hours, that will be completely done. We no longer have to worry about it. So moving on to the next thing, I want to talk about your medications. Either we had prescriptions delivered to your house, you picked them up, or we had them ready for you at the office. It all depends on how your insurance and your prescriptions are set up. So we'll kind of walk through your prescriptions. You could have had anywhere between 2 to 4 prescriptions. And what I have to do immediately when I get a prescription is just go ahead and label them. So you can see there might be a drug called ceflexin or clindamycin or Bactrim. That is an antibiotic, so you can see I just went ahead and put antibiotic on mine, so we can kind of keep them nicely separated for the next couple days. Each one of those medications has a different schedule or a different regimen in how you take it. Ceflexin, which is works with my allergies, is taken 4 times a day for 5 days. So make sure you check your bottle on how you're going to take your antibiotic and label it and put it off to the side. Your next medication you're going to pull out is probably called hydrocodone acetaminophen. This is a pain medication, so I have labeled it as a pain medication. It is a prescription pain medication, and it does have a narcotic inside, although it is a very low dose. Now, the night of your procedure, we want you to get a decent night's rest. So we advise people as soon as they feel any discomfort to go ahead and take the prescription pain medication at least for tonight. Tomorrow, when you have a lot more kind of mental bandwidth to figure out can you take just Tylenol versus the prescription, is a lot better time to try to get yourself off of this. It is, with the amount of pills we give you, is very low addiction potential unless there's already been an addiction kind of issue in the past, and we hope to be off of this by noon tomorrow. So as soon as you feel discomfort, go ahead and please take one tonight. I am approximately 6 hours out of my procedure and I don't feel any pain whatsoever with no Tylenol. I am still going to take one of these before I go to bed, or if I feel any discomfort kind of starting to kick in. It will help you get through the night, and the risk is relatively low taking it for a day and a half. The third medication, which you may or may not have got, is a steroid. Either prednisone or methylprednisone. I've labeled it as a steroid. These come in usually kind of predetermined dose packs. For this one, it's a 6-day regimen, and it has different amount of pills you take each day, either before breakfast or after breakfast, before lunch. When we prescribe these, we do so for a couple of reasons. We prescribe them purely for one reason, is to really reduce swelling. So if you've had a large amount of grafts, or you've had grafts in your frontal hairline, or if we think during the procedure that you might just exhibit more swelling, we might prescribe a steroid. If you don't get it, it's totally fine. Steroids are only about 50% effective in reducing swelling anyway, but we just prescribe it in kind of the best efforts to reduce swelling. So if you did tell us you have a major event coming up in the next 8 days, we will have likely prescribed a steroid to help you get that swelling down. But do not worry if you do not. The side effects of steroids, they can actually slow down healing, so we don't prescribe it unless we really need to. If we prescribe it, you don't want to take it, absolutely fine. It's not going to affect your course. The fourth medication that may still be in your prescription bag is actually your Valium, or the generic name is diazepam. This is the medication we used as a sedative during your procedure. You want to get rid of this. You no longer need it. You don't want to get in the hands of anyone in your household, so I recommend you just kind of flush it away and just not having to deal with it again. So that is kind of the basics of what to do tonight in terms of like what we package you. So come home, have some food, take your medications out, see if you can separate them. And now we're going to walk through what you should be taking out of the little bag we gave you for the night. And some of you have kind of opted to get your own materials. So number one you want to pull out is this spray bottle. This spray bottle is going to be used to keep your grafts nicely hydrated. What you're going to do is you're going to take it and fill up with regular tap water. Let me fill up mine really quick. And the water can be lukewarm, it can be cold, it does not matter. It'll eventually become room temperature. What we're going to do is we're going to try to get this to a mist setting, so a light mist. And the way we're going to use this over the next couple days is to actually just mist our grafts very lightly to keep them hydrated, not damp, not wet, but hydrated. The goal here is to prevent them from drying out. When grafts dry out, they can actually kind of start itching your scalp and cause a little discomfort. So this is going to be your number one best friend for the next about 4 to 5 days. So keep that off to the side. Just regular tap water is totally fine. Again, a mist setting, and just indirectly kind of spraying it onto your grafts, not trying to drench them or make them too wet. That is very key. The next thing we have, again, is optional. We gave you 2 ice packs. You can shake these, and you can kind of activate them by squeezing them. If you're going to use an ice pack, if you do, most people have had grafts of the front hairline, and you want to reduce swelling. I just want to show you how to do this. Again, this is optional, you don't need to do it. You just want to put the ice pack onto your forehead and eye area. You do not want it touching your grafts, right? And you're just going to do this maybe 15 minutes every couple hours. We did give you 2 of these packs. The packs can be recooled. So once you crack one, put it in the fridge, crack the next one, put it in the fridge, and just kind of alternate. And again, 15 minutes every 2 hours is just fine. Really, you're putting it over your forehead and your eye area to prevent the swelling of those spots. Again, optional. We're just doing whatever we can to minimize the swelling. Going through the bag furthermore, if you go in there, you'll find some Tylenol. Now, for people who are really opposed to the prescription medication, you can use the Tylenol for your pain control. The one thing you do not want to do is combine the pain medication with the Tylenol, so you don't accidentally overdose on the Tylenol component, not the narcotic component, but the Tylenol. You can take 4,000 milligrams of Tylenol in a day, 1,000 milligrams at a time, they'll be fine. But mixing these two can be difficult, so the first night we do recommend the prescription, and you can switch over to Tylenol tomorrow, but just don't take them both at the same time. Next, you'll kind of notice you have a bag of gauze. This is different than the bag of cotton balls right in there. The gauze is purely in case if you have an area that bleeds a little bit on your scalp, you can just take the gauze and just hold a little pressure right over the spot where it bleeds, or to even dab away any kind of moisture. These are nice and clean. They tend not to stick to your hairs, but again, if you see a spot that's kind of running, take your finger directly over there, hold some pressure down using the gauze, and that's what these are for. So 2 more things out of the bag for tonight that you'll need. Number 1 is your sleeping pillow. It might come in a case, it may not, so we do if it doesn't. The sleeping pillow is going to be key to holding your head in position while you sleep at night, so you don't accidentally hit the hairs on the new grafts we have placed. To go along with the sleeping pillow, we have these underpads. We call them chucks. These underpads are just absorptive, and they're just meant so that nothing in your house gets dirty. I like to put them over my sleeping pillow, and then when I put the sleeping pillow on, I'm just not getting the sleeping pillow too dirty, so it's just covered up. Now in a separate video, I'll show you how to sleep for tonight. But essentially, this is everything for tonight. Now it's a lot of information in a relatively long video, but you can go back, watch it as many times as you need. And this is essentially all you need for the night. Everything else in the bag, do not worry about. So in a quick review, come home, have some food, get your medications laid out and kind of in order. Make sure you get your spray bottle filled. This is what your most handy thing is going to be for the next couple of days to keep your grafts nice and moist. You have ice packs, and you have your sleeping pillow. You got your underpad to kind of keep that thing cool, kind of keep it clean. And then you have some gauze in case you do have some drainage from any one spot. You can address it. If you have any questions, of course, you guys have 24/7 access to us. Please drop us a message whenever you like about the evening, and look out for the next video on how to sleep tonight. Thank you.